Hello everyone, you are welcome to today's class, PHS 223, and we're still talking about demography and social statistics in public health. Demography and social statistics in public health. Today we'll be continuing with lecture note 3, and this will be our third lecture, and we'll be dealing with the subtopic, as you can see, Introduction to Mortality, Fertility, and Migration. So we'll be discussing in detail mortality, fertility, and migration. Within this topic, we will see the introduction to the topic, demography, transition theory, how does it affect mortality, fertility, and migration. We will see the different stage of the demographic transition. We would also be seeing fertility in public health, digging deeper to see how fertility rate is affected and what affects it and the different terminologies involved. We will also be seeing under this topic subtopic 4, mortality and public health. In continuation, we'll be seeing migration and public health, and then we'll round it up with impacts of fertility and mortality on population dynamics. So we will see the dynamics, we'll see the impact and how it affects it, then we will conclude. So let's go back and begin from the very top. Introduction to mortality, fertility, and migration. From what you see on the slide, understanding the dynamics of population changes is fundamental for effective health planning. Mortality, fertility, and migration are key demographic factors that influence the health and well-being of populations. Now, in the realm of public health, understanding these dynamics of population changes are key in order for us to be able to do a proper development of effective health policies and programs. Now, when you hear the word mortality, fertility, and migration, these three core aspects are the core demographic factors that directly affect the health and well-being of population. They have a way of intricately affecting any population you can think about. These factors are intricately linked. They influence not only the size and structure of the population, but also the demands on healthcare system and resources. In fact, they shape the need for healthcare services and interventions, including maternal and child health programs, infectious disease control, and also the aging population management so that we can take care of the aged population. It also affects allocating resources efficiently and prioritize health interventions in specific demographic groups. So what have we just talked about? We have simply said that mortality, fertility, and migration shape the need for healthcare services and interventions, including many other programs as mentioned. For instance, if a population experiences high fertility rates coupled with high mortality rates, the emphasis may be placed on reducing maternal and child mortality and improving healthcare access. In contrast, you will have populations with low fertility and low mortality might, focus on managing chronic diseases in aging population. Now, what are we seeing here? We are trying to compare one aspect to another. We are saying that in those populations that experience a high rate of birth, and then they also have a high rate of death, the emphasis therefore in that kind of a community will have to be ways we can reduce maternal and child mortality so that we don't lose our mothers and we don't lose our babies. And that way improve healthcare access. On the other ground, if you have a community, a population where there is low fertility, not much children are born, maybe because the women there on a large scale have reached menopause, you don't have the young Gen Zs or young generation a lot in that community, then it means that we will have to focus on managing chronic diseases in aging population as well. Now, migration, which involves the movement of people within or between countries, will definitely introduce additional health dynamics because people are moving from one point to another, and as they move with other things with them. And so, you have other problems like spread of diseases, changes in healthcare access, and resource allocation cropping up. And this is very, very important that you understand. Now, number 2, let us see demographic transition theory. The demographic transition theory. The demographic transition theory, it's a framework that actually explains the transformation of a society's population structure and health profile as it comes through different stages of development. And so when you look at a population, a society's population, you will imagine that there is a structure in that population and there is a health profile as it moves from different stages of development. And you see, this theory is crucial for understanding how public health policies evolve in relation to the growth of such economy, technological advancement in such economy, and improved healthcare systems in such economy. Therefore, as countries transition from developing to developed status, their death rates generally will decline. So, as a country is getting better, improved healthcare access, improved healthcare services, improved health workers, and all those things technologically available, you would see that ordinarily things that does lead to death in the past, like malaria, like cough, respiratory disorders, diarrhea, now will no longer be a problem because everything has improved. The care, access to treatment, maternal care is now available. As a result, you will have the problem of death rate generally decline. So it's very important because those are signs of a place becoming from developing to a developed world. So you will see clearly that their birth rate, by the grace of all the input that have been put in, by reason of the development, will improve. There will be no excessive birth because there are now control measures. Birth control, education campaigns have really gained wide acceptance. And so families now undertake family planning. You also have death rates would have generally declined. And this will now result in a slower population growth. Now you see this transition is typically observed in 4 or 5 stages. Now each of them is marked by significant changes in societal factors, such as the living standard in that economy, the healthcare access in that economy, and the family structure. So we are going to look at it under 5 stages. Number 1, that is stage 1, high stationary. And this is characterized by high births and death rates. High births and death rates. And this leads to minimal population growth. As more babies are coming, they lose more too. Stage 2, early expanding. Early expanding. In this case, you find population growth increases due to a decline in mortality, while fertility remains high. So there is increase in fertility, but there is a decline in mortality. Stage 3, late expanding. Late expanding. Both birth and death rates decline, leading to slower population growth. In stage 4, you have low stationary, where you have birth and death rates are both low. And that way, you have a stabilizing population growth. In stage 5, that is referred to as declining, where birth rates fall below death rates. The birth rates fall below death rates, resulting in a decrease in population. Now let's look at them in detail. Stage 1, high stationary. In this stage, both birth rates and death rates are high, the both of them, and that leads to a stable population size. Not increasing, not reducing, the gap is just there. No more changes. It tends to just cancel each other. That equilibrium is maintained. Now, this stage is typically associated with pre-industrial societies with limited access to healthcare. So, that there's no healthcare doesn't stop them from giving birth. At the same time, it leads to large exposure of mortality rate because many of them die in the traditional birth centers, or while they are trying to give birth at home, or even after they've given birth, infection takes the life of those children. That's that. Now, as a result, the population remains relatively constant despite high fertility, as many children die before reaching adulthood. And that's between the ages of let's say 1-2 months to 2 years. A lot of them as a result of the lack of care and adequate treatment. Stage 2, early expanding. The population begins to grow rapidly because death rates decline due to improvements in sanitation, due to improvements in nutrition and healthcare. However, birth rates remain high. Now, reflecting traditional, and not only that, it reflects a normal social, atmosphere. Because if you look at it in this pattern, you will see that the population just begins to skyrocket rapidly. And why? The death rates decline. And mind you, improvement have taken place in a lot of areas. A lot of areas. The healthcare has improved. So mothers are giving birth, babies are surviving, people are doing well. So when you look at that proportion, you will have the population skyrocketing. Now, having said that, public health interventions during this stage often focus on reducing mortality, particularly among children and mothers. And so that pace is maintained and the population keeps skyrocketing. Stage 3, late expanding. Under the stage 3, you have birth rates beginning to fall. Remember, stage 3 is late expanding. You have birth rates beginning to fall as families shift from high fertility to low fertility. We have already gotten the number of children we need and we do not intend to add more. So because of that, you find out that the shift comes to play. And this shift is influenced by increased urbanization, increased education, and the combination of falling births. And because of the improved healthcare services, the combination of falling birth and death rates, and both will lead to slower population growth, which you find very evident. Now, public health policies at this stage will focus on promoting family planning so that they don't give birth to more, and addressing the growing needs of an aging population. So you already have the number of children that you want. You do not want unwanted pregnancies. You encourage to go for your family planning, and then those who are already aged will take care of their needs. So that's the focus in public health policy for that stage. For the stage 4, low stationary. Low stationary. In this case, you have both births and death rates low. You see that? Both the births and death rates are low, resulting in a stable or slowly growing population. Now, this stage is typically of highly developed countries with advanced healthcare systems, high standards of living, and widespread use of birth control. And so public health strategies in this kind of population may shift towards managing chronic diseases, concentrating on treatment, promoting health aging, and improving healthcare accessibility. Their worries have gone beyond issue of death rates and birth. Why? Because both birth rate and death rates are low. They've done enough. In fact, they've done good job to keep it at bay. So they now concentrate on diseases, chronic diseases, promoting health aging, and improving healthcare accessibility for their community. Stage 5 is the declining. Stage 5, declining. In this final stage, birth rates fall below death rates, leading to population decline. So when people no longer want to give birth, or the level of birth rates have gone so low, and when you compare to a death rate, it's even lower than the death rate, even though the death rate is also low, this will lead to population decline. Seriously. Only few people are dying, and to make it, more wonderful, you have people being born, babies being born, far less than babies or death rates that occur. This is very important. Now, this phenomenon is most noticeably in some European and Asian countries with aging populations and low fertility rates. Everywhere, aged populations in a large number, their young populations have all moved, migrated to other parts. In fact, you find that in Asian countries too. Public health efforts focus in this area on managing the health needs of the elderly, because that's the people you have in a large number, and preventing the societal impacts of an aging population, and addressing the economic challenges associated with shrinking workforce. So they have to address it, because the workforce is being shrinked, because a lot of them are retiring, and you don't have younger people taking over from them. So that is it for demographic transition theory. Let's move to fertility and public health. Fertility and public health. Under the fertility and public health, we'll be discussing the determinants of fertility, and we'll be discussing total fertility rate. The determinants of fertility and total fertility rate. We'll also be looking at, under the determinants of fertility, we'll see the biological and then the behavioral. Let's see it in details now. Fertility rates refer to the number of live births a woman has during her lifetime. I repeat, fertility rates refer to the number of live births a woman has during her lifetime, and they play a crucial role in shaping population. They play a crucial role in shaping population structure and public health priorities. So we are now looking at fertility, and we understand that it refers to the number of live births a woman has during her lifetime. And we've seen that it plays a crucial role in shaping the population of anywhere, the population structure, and the public health priorities in that area. Now, high fertility rates can strain healthcare systems put it under pressure, as high birth rates often correlate with higher rates of maternal and infant mortality, limited access to healthcare, and inadequate resources for child development. So when you have a high rate of fertility on the long run over the number of years, you will see a lot of pressure on the existing facility, the existing healthcare system. Then you have issues or challenges like limited access to healthcare occurring because of the limited availability of PHCs, public health centers, and also you will now have inadequate resources for child development. On the other hand, a declining fertility seen in many developed countries shifts the public health focus to managing the health needs of an aging population, like I said, including chronic diseases, dementia care that affects adults, and age-related disabilities. Now let's see the first one that discusses fertility rates, that is determinants of fertility. What are the determinants of fertility? Number one, biological factors, and this includes the age of a woman when she begins menstruating and when menopause occurs, when she begins to menstruate and when menopause occurs. These natural biological processes indeed influences ovulation and overall length of a woman's fertility span. Now you see, these factors directly affect the likelihood of conception and also the timing of childbirth. Once you can tell at the time of the menstruation, and also you know at the time of menopause, together they directly affect whether there will be conception ever again or not, and also the timing of birth, if you understand ovulation as it were. Now let us see behavioral factors. Now these factors are influenced by both the culture, social, and also economic considerations. The key behavioral determinants include the age at which women marry or begin childbearing, the frequency of intercourse, the use of contraception. Do they like it? Do they believe in it? Does their system support it? Does their culture, agree with that phenomenon? Voluntary sterilization. I don't want children again. I already have 3. I'm going for a permanent sterilization or a permanent birth control system, a birth control option. And access to abortion services. You don't want the child under the law. You are permitted. Do they have such access? Or does it look like in some countries, in the UK or in America, where you are not permitted to carry out abortion services or access one? So societies with greater access to contraception and family planning services have been observed to tend to experience lower fertility rates. Why? Because they have access to a lot of contraception, and so even if they are actively sexually active, they don't get pregnant, or they get pregnant by choice. And then you have family planning services that tend to help them so that they can have good experience in terms of lower fertility rates. On the other hand, let us see the next one, which is total fertility rate. Total fertility rate. And this is a crucial indicator of fertility, which measures the average number of children a woman would have during her lifetime. Now, assuming current fertility rates across age groups remain unchanged, that is, the total fertility rate, about 2.1, is considered the replacement level, which maintains the population size over time. So, the TFR is used to assess the need for family planning services. So we look at her and we examine her and we're able to tell the level of fertility, total fertility rate for that woman. So in her lifetime, the number of children she's likely to get. And so you calculate and you are able to assess and you're able to advise to for the lady to access the need to access family planning services and maternal health care programs. And the overall capacity of the country's health system will improve such that it will be able to support that population. Now, once again, let me further explain the total fertility rate. Like I said, it measures the average number of children a woman would have during her lifetime, and assuming current fertility rates across age group remain unchanged. Assuming the current fertility rate across age group remain unchanged. So if it remains unchanged for all the ladies in that community, and it means that, okay, having assessed them, every one of them is most likely, they have the average chance of giving birth to at least four children, 4 kids. Now 4 times maybe a 200,000 women in that population, in that community. They all have the chance of giving birth to 800,000 babies in 1 year if all of them give birth one by one. So in a space of 4 years without control, you will have 200,000 baby in 1 year, another 200,000 baby again, another 200,000 baby. So if assuming that in their lifetime or by calculating their total fertility rate, each of them can give birth to 4 children. So within a space of 10 years, you will find out that each of them have their 4 kids. That's 4 times 200,000, that's 800,000. And some will mistakenly, probably even give birth more than 4. So by that calculation, if it remains unchanged, the TFR, which is about 2.1, is considered the replacement level, which maintains the population size over time. Now the total fertility rate is used to be able to assess the need for family planning services, all the maternal health care programs that are needed, and overall the capacity of the country's health system to be able to support that population. And this is very, very important. So high fertility often leads to higher maternal mortality rates and can strain healthcare resources. Conversely, declining fertility, as seen in many developed nations, can shift and focus on public health to issues of aging and chronic diseases. So this is important. So let's move to the next one, which is mortality and public health. Mortality and public health. Remember, we have talked about fertility. Now let's talk about mortality and public health. Under the mortality, we'll be seeing 2 key aspects: the key mortality indicators, and under it we'll be talking about the crude death rates and also the infant mortality rate. And then number 2, we'll be seeing the maternal mortality rate. So the key mortality indicators and the maternal mortality rate. So it's important that we look at that. So let's see it in detail. Mortality refers to the number of deaths within a population and is a key indicator of public health. Mortality patterns reflect not only the effectiveness of healthcare systems, but also the living conditions, environmental factors, and the prevalence of chronic diseases and infectious conditions. Under key mortality indicators, there are 2 aspects: the crude death rate, which is the CDR, and also the infant mortality rate, which is the IMR. Now, under this crude death rate, the rate measures the total number of deaths in a given population over a year, and it is usually expressed by 1,000 individuals. So while CDR provides a general overview of mortality, it does not account for age structure. It just tells us the general overview of the mortality. It does not account for age structure, which is why it is often supplemented by age-specific mortality rate. It is often supplemented by age-specific mortality rate. Take note about that. Now, in the case of infant mortality rate, this is the number of deaths of infants under 1 year of age per 1,000 live births. It is critical. It is a critical indicator of healthcare access. The quality of maternal and child health services and the socio-economic conditions of a country. A high IMR is often associated with poor maternal health, inadequate nutrition, and lack of access to neonatal care. Now, it's simply defined IMR as the number of deaths of infants under 1 year of age, and we do that per 1,000 live births, just like we do that for CDR per 1,000 individuals. Now, we have also seen that this indicator is a very critical one in the healthcare industry or in the healthcare for, checking the quality of maternal and child health services. And so with this, we're able to look at the quality that is being, achieved and the socioeconomic conditions of such a country. So when you have infant mortality very low, it speaks well for that country. But a high IMR is often associated with poor maternal health, inadequate nutrition, and the lack of access to neonatal care. Now let's see the second one, maternal mortality rate. Maternal, now not infant anymore, maternal mortality rate. Now this refers to the number of maternal deaths during childbirth per 100,000 live births. It serves as a crucial indicator of the effectiveness of maternal health care systems, just like the infant mortality rate, including prenatal care now. The other one, it's about infant care. Now, this includes prenatal care, the act of safe delivery practices, and after birth, the postnatal care for these babies and also the mother. High MMR, that is maternal mortality rate, indicates a very serious poor health care infrastructure and inadequate access to skilled birth attendants. That is the unavailability of health workers, of birth attendants in those public health centers, which predisposes the women to maternal deaths. And so a high MMR doesn't speak well of any health infrastructure or health system. But a reduced MMR indicates improved healthcare infrastructure and adequate access to skilled birth attendants. So by analyzing mortality trends, public health professionals can identify risk factors and high-risk groups, allowing for targeted interventions such as the use of vaccination program, maternal health initiatives, and policies addressing lifestyle diseases like cancer, heart diseases, and also diabetes. So, for mortality and public health, the key mortality indicators are very important, and then maternal mortality rate is also very, very important. So we have seen the three: crude death rate, infant mortality rate, and maternal mortality rates. Maternal mortality rate. So those are the three indicators that we have just talked about, and they are key in understanding improved public health system. Now let's see number 5, migration and public health. Migration and public health. Under it, we will be seeing the types of migration, which includes both internal migration and international migration. So let's see them in detail. Migration, the movement of people within or across borders, indeed has profound implications for public health. Migrants face unique health challenges, and that includes exposure to new diseases as they move from one point to another, changes in lifestyle, and also changes in their living conditions. And varying levels also come along. And when we mean varying levels, we mean varying levels of access to healthcare services, because when they get there, they probably will meet a less better healthcare services or less better accessible healthcare services compared to where they are coming from, which often include those that have specific challenges and they are in dire need of that services. Unknowing to them where they've migrated to, they cannot get such services. And so you see the implication of that to public health. Now, public health system must address health needs of migrant populations. You must consider that those who came in with diabetes, those who came in with stroke, those who came in one problem or the other, the healthcare facilities must be available to cater to them. Otherwise, it's as good as going from bad to worse. And this, when put in place, will improve the public health system. And like I've said, public health system must address the health needs of migrant populations, which often include those with limited access to health services or the vulnerable living conditions. What are the types of migration? You have the internal migration. This refers to the movement of people within a country, often from rural areas to urban centers, in search of better economic opportunities. They want a better economy, they want a better system, a better health facilities, a better job opportunities. And so internal migration can strain urban healthcare systems as the demand for services in cities increase. The more people keep coming in with their infections, respiratory diseases, one challenge or the other, need for drugs, the pressure keeps mounting on that facility that originally was catering for less amount of persons, but now it has to cater for more amounts of migrating citizens, migrating individuals. Now internal migration can strain, like I said, urban healthcare systems, and therefore the demand for services in cities as it increases will cause the government to also change its policies and improve supply. Now, while rural areas may experience a decline in healthcare providers, you have the urban demanding for an increase of healthcare providers. Why? Because in the rural, people are migrating, citizens are migrating, and when they move to the urban, the number increases and the demand for increased healthcare workers will also come up. Number two is international migration. International migration, and this involves people moving across national borders, often due to factors like economic opportunities, could be conflict, or environmental changes such as climate change. You have international migrants, in most times they bring new health risk to their host countries, and that's why we have different checks, examinations taking place at the border, at the airport. These are checkmates in order to be able to manage such occurrences. So like I said, these international migrants, they may bring new health risks to host countries, such as infectious diseases that are not common to that host population, just like Nigeria experienced with Patrick Sawyer when we remember the COVID-19 saga. The Ebola saga. Now, while migrants themselves may struggle with access to healthcare in their new country, you have more problems compounding the existing problems in that new country. The public health response to migration involves ensuring that migrants have access to healthcare, preventing the spread of infectious diseases, and addressing the unique social and economic challenges that they face. And in doing that, you protect the population already on ground, you curb the spread of that new infection. That way, you are able to mitigate an adverse effect on the public health system. Let's now see migration. Number 6, which is the impact of fertility and mortality on population dynamics. The impact of fertility and mortality on population dynamics. We'll be seeing it under high fertility plus high mortality. We'll also be discussing the low fertility plus low mortality. But we want to see the impact of fertility and mortality on population dynamics. How do they relate? What's the gap and what occurs? Now, this interaction between fertility and mortality directly shapes the demographic profile of a population and by extension its healthcare needs. Public health strategies must be tailored to the specific dynamics of each country or region. It has to be specifically tailored to the specific dynamics of each country or region. In other words, every country has their unique dynamics. And so specifically for public health strategies, it has to be tailored according to the data that we have received. Not using another country's data, but your data that you have gotten from your own country, used to dynamically design a workable policy or strategy that will help mitigate the challenges in your own country. Let's see the first part, high fertility plus high mortality. Now this combination is common, very common in less developed regions, where rapid population growth and high mortality rates create significant health challenges. Public health interventions in these regions often focus on reducing mortality, particularly maternal and infant mortality, and then they promote family planning to lower fertility rates. Now let's see also low fertility plus low mortality. In this case, you find this in more developed regions. This scenario leads to population aging. So you have people, not like we said the last time, the number of births even getting lower than the rate of mortality, the rate of death. And so in this scenario, you see it leading to population aging, where a lot of people get old, aged, where the population of elderly individuals keep increasing. Public health priorities in such an environment will shift towards managing the health needs of these older populations, addressing chronic diseases, improving long-term care services, and promoting health across the lifespan. And therefore, in conclusion, we see that the relationship between mortality, fertility, and migration is central to understanding and addressing public health challenges. And we've seen that fertility and mortality rates, they really guide public health strategies by highlighting areas where interventions can have the greatest impact, whether in reducing the infant mortality or promoting family planning, or perhaps managing the health needs of an aging population. Additionally, we've seen that migration patterns help shape the global distribution of health resources and public health priorities. I'd like to conclude by saying public health efforts must be adaptable. It must be taken into account the specific fertility and mortality patterns in each region. You don't use a data from another region. Therefore, you must get your own data from the different demographic methods that was mentioned in our earlier study, and the impact of migration on the distribution of health resources should be intensely, applied. So at this juncture, I want to thank you for being part of the lesson topic, lecture topic 3. And so I believe that we have done justice to it. Remember, you are expected to take notes. Yes, as you listen, you pause, you play, you take notes, then you take time to study. And so we have just concluded the topic, mortality, introduction to mortality, fertility, and migration. So I'll see you in lecture notes 4. Thank you. Bye.